A Hanover man got the medical help he needed just in time to save his life. But now that he's healthy, he's facing the possibility of bankruptcy. Our Bree Season went to work on his surprise bill.
Chris Tatum is on a holiday boating trip when he feels heartburn and then numbness begins creeping up his arms. He goes to the nearest emergency room where staff immediately loads him onto a helicopter and sends him to a different hospital. This wasn't a situation where he could shop around or compare rates. Months later, Tatum felt he had no way to fight a sky-high bill from that helicopter company.
When you are anxious and stressed out and upset over something like this, sometimes it's hard to get your mind centered.
Anxiety and stress over an almost $40,000 medical bill rallies an entire family into a letter-writing campaign.
This is an outrageous example of price gouging using balanced billing.
You get tired of fixing everything.
Chris Tatum tells us this billing odyssey began with his heart attack on Labor Day of 2018.
And I was hoping there'd be a prescription or something, and I'd be back out to playing.
Instead, Bon Secours doctors dispatched a helicopter that flew him to Memorial Regional Hospital.
Hi, Mr. Tatum. We're going to take you to Mechanicsville, and we're going to be there in 20 minutes.
To his family's great relief, Chris is still with them, crediting excellent medical care.
Then so I can tell you with the ridiculous bill.
The bill, arriving from the helicopter company Air Methods, demands nearly $40,000 on top of the more than $18,000 already paid by Tatum's insurance company. United Healthcare telling the problem solvers their payment, quote, is more than fair based on average market rates.
An appeal was made to the insurance company for additional payment but was refused.
Despite tremendous outreach efforts, the Tatum family made no progress and the bill went to collections.
What they are doing, and what they even admit to, is that they are overbilling someone that is private insurance like he is.
In fact, Air Methods does admit privately insured patients like the Tatums make up 30% of their flights, but they end up paying over 70% of the company's operating costs. In a statement, Air Methods expressed regret for the Tatums' ordeal, but says, quote, to truly take the patient out of the middle, we need more streamlined insurance appeals processes, more insurance companies willing to go in-network with Air medical providers, and a more accurate reimbursement model for Medicare and Medicaid, end quote. All of those issues are out of Chris's hands, but not far from mine.
What would it mean to have this off of your back?
Of course, we'd breathe a lot better, and we'd sleep better at night, not think about how's this going to end up. Yeah, because we worried about bankruptcy.
We spent weeks working on the Tatum bill and just learned United Healthcare reached a settlement with Air Methods. Chris owes nothing. What happened to him is called balanced billing, and Virginia is one of several states with no consumer protections to stop healthcare providers from sending these surprise bills. And unfortunately, the practice will continue. Congress appeared ready to pass bipartisan reforms at the federal level, but the deal fell apart this week. We've managed to save viewers more than $55,000, though. If you have a problem with surprise medical bills, tell us about it at WTVR.com/yourbill.